Welcome to Caring.
Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well.
Caring Well. Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well, Middleton Pediatrics podcast, where we have conversations to help you care well for your child. Today's conversation is with Marvin Hardy and Stephanie Garris, and it is about Grace Medical Home. Marvin is physician and founder of Grace, and Stephanie Garris is the chief executive officer. Grace is a faith-based medical clinic here in our community, caring for the working uninsured, has been doing so for over 15 years, and is truly one of the brightest lights of healthcare in our community. So let's go learn more about them, be inspired, and go to that conversation. Stephanie, Marvin, welcome.
Thank you.
Yeah, thank you guys so much. This is going to be a lot of fun. I was just telling someone, Grace is such an easy story to be excited about. Mm-hmm. And so I'm excited to hear you guys share. But I would love for maybe both of you, one of you, to give sort of like the 30-second version of what is Grace Medical Home, for if someone listening has no idea.
What I tell people to think of in regards to Grace Medical Home, especially when I think of Middleton Pediatrics, is just think of Middleton Pediatrics for the low-income uninsured. It's a place where they can go over and over again, where their chart is kept, where their name is known. They can go for a physical exam if they need a sports physical, if they need vaccines, or if they're sick, or a referral. That's exactly what the uninsured struggle to find. So it's basically like Middleton Pediatrics, just for the uninsured, low income.
So maybe one way to keep going with the thought, because I think it throws some people off, the idea of a medical home. So help people understand what that means in this context.
A medical home, first of all, is an ideal. It's what primary care medicine should look like. It's a place of continuity. It's a place of it's one's home base, or medical home base or hub, and again, that's what the uninsured low income do not have. Our patients can't believe they get to go over and over again.
In some ways, Grace is about so many things other than the metrics. So I'd like to maybe share a little bit of the metrics, almost in the spirit of let's get that out of the way. And so things like whatever, number of patients served, volunteer physicians, estimated money saved, whatever metrics that you feel like help tell the story of Grace. Maybe share some of those, Stephanie.
Sure. Yeah. We have about 1,300 unduplicated patients. And in 2025, they're very sick, high acuity. So we had over 17,000 patient encounters. So they're coming here not just for medical, dental, social work, to pick up food, medicine, things like that. We've been open for 15 years. And every year, our patients have to re-qualify. And so it's reverse qualifications. They have to be living at or below 225% of the federal poverty level, and they can't have any insurance. And so we screen them. As long as they meet that criteria every year, their situation hasn't changed, they remain a patient. They typically stay a patient for about 3 years, but they come 13 times a year. So that's almost, 40 visits to improve their health, to stabilize it, to diagnose what's needed, to fix a cracked tooth, whatever that may be, and then to, hopefully improve their situation.
And so just to pause you for a second, the reason that they aren't longer than maybe average of 3 years, because either moving towards a commercial insurance situation or a government assistance situation.
Correct.
Medicare.
Correct.
Like that. Okay.
Or they improve their health and maybe they get married or they move away or whatever. Yeah. So it's always sad when they leave us, but they're much better off when they do, and they're stable. We provided last year about $13 million of care. So the ROI on supporting our patients, keeping them out of unnecessary emergency rooms, I think is very, very high.
Before we get too far into our discussion, kind of define the geography and the scope of Grace Medical. So this is the second iteration as far as a facility. So kind of say where we are and who exactly, as specific as you can be, that Grace Medical serves.
Sure. So we're located just south of Colonial and Mills, so in the Colonial Town area by the downtown YMCA, so tucked in a really great neighborhood. That's where we physically are. It's 19,000 square foot building, but we also have a building across the street that it does our mental health counseling. So we have 2 buildings here, and then we have a mobile medical unit. We have over 1,300 unduplicated patients. We only serve the low income uninsured, and low income is defined as 225% of the federal poverty level and below. So that's a household income for a family of 4 of just over $70,000. And we only serve people who live in Orange County.
Adult and kids.
Okay.
So
All ages.
all the way up to 65 or older.
Marvin, tell the story of what led you to start Grace.
Well, I grew up here. I grew up not too far from here. Grew up right across the street from your wife.
Yep. We'll come back to that, actually.
Yeah. We went to public schools in College Park, and was after college and medical school and residency, was fortunate enough to come back here. The stats in our county as far as healthcare is concerned is not that great. And it was hard for me being from here to keep reading that. And I'm one that wants to do something about it kind of person. And let's fix that. Over time, that just started to eat at me more and more. And I loved where I was working. I had a great experience there, but after a while, just felt like I was driving in the wrong direction.
In retrospect, do you think those sentiments that were, I hear you saying they were crescendoing to a point of, I have to do something about this. In retrospect, do you feel like they were always there? I mean, as soon as you were in medicine?
No doubt. No doubt. Even that's what led me to medicine. I heard a quote in college. It was a prayer from the founder of World Vision that said, God, may my heart be broken by the things that break the heart of God. It was the first time in my life I thought, is God's heart's breaking, really? And then where is it breaking? And that kind of led me to medicine. In med school, I was exposed to just inner city ministries and the need all around us that's right here that we didn't even know in Atlanta when I was in med school, just like a lot of folks don't know here in Orange County, of the need that's right in front of us, of our neighbors, of our friends, of our coworkers, people that we're on the ball fields with, or that we see at Publix, or that live down the street. And
this is both their health needs and their lack of resources for those needs. Kind of that's right. Troubling combination. Yeah.
As I kept moving through my training, and even after being here in Orlando, it just that kind of pounding in my heart just kept going stronger and stronger and stronger. And then finally I woke up my wife in the middle of the night and I was like, Carla, we got to do something about this. And she said, it's about time. I'm ready to go. And I had kept an article about a Christ-centered medical practice for the poor by my bed for 4 years and 2 moves before I did something about it. But what the amazing thing about that was, as soon as I visited that clinic in Atlanta and then started to share that vision here, there was a whole lot of other people that were ready to go as well, that I believe God had touched their hearts as well. And you were a great encouragement throughout all of that, as other people were too.
Even what you're saying, though, that probably a lot of people don't appreciate, the stirring you were feeling was happening other places simultaneously, and it just needed to get connected.
Yes. Yeah. There's 8 founders of Grace. What I learned through that, if God puts something in your heart, it's not meant to hoard or keep it to yourself, but to share. And many times he's moving and other people around you that you have no idea. And that was the case of Grace. And that's what's made it fun to be a part of. There's great momentum here, and there always has been, and there still is now because of that. It's a community effort.
Steph, you joined at what point in the 16
2009.
years? Okay.
Yeah, November.
And so kind of what were you doing before? What led you to join? And then again, kind of in retrospect, what had maybe was stirring in you that you didn't even know was going to come to fruition in Grace, but now it's clear is?
I lived in Washington, D.C. for 10 years in my 20s after I graduated UF. I went to law school at night. I always worked in health policy and was really passionate about health equity. So I had, an 8-year career there, 8 or 9 years, and that was my focus. And then I met my husband, we got married, and we came back to Florida. And so When we came back, there aren't a lot of policy jobs in Orlando. So I worked for the American Cancer Society because in a prior role, I had done fundraising and I love it. I love community engagement and advocacy and things like that. So I was hired as the executive director of the American Cancer Society, which was great. I loved it. I had 5 counties and a good staff. So I was there for a couple of years and then we had kids and we had kids pretty quickly. I was a little bit older and it just was, for me, too difficult. So I took a pause. I was home for 10 years with the kids. And then my youngest was going back to starting kindergarten. And I thought maybe it's time to go back to work. And so I had updated my resume and I'd heard about Grace. I had toured Grace. I loved it. It's what I felt I was called to do. And I thought, well, it's just such an amazing place. But they had hired an executive director when I had toured. And so Marvin and our kids were at the Christ School, and I was doing a supply drive for Grace with one of the service projects. It was before we opened. And I was in chapel, and I came up to Marvin. I said, hey, have you opened? I toured 4 or 5 months prior. And he said, no, the executive director quit. And I happened to update my resume and had interviewed at Lowndes. I'm a lawyer, and who wants to do that? No offense. Lowndes is great. No offense, but
you're just saying you didn't.
I didn't. I just didn't want to practice law. And so all I can say, Michael, is I believe the Holy Spirit turned the car around because I was going to the gym. I was in workout clothes. My hair was in a ponytail, and I'm driving.
It wasn't what you woke up planning to do that day as far as apply for that job.
And I turned around and I had the resume in my car and I brought it into Marv and I said, if I can help in any way, here's my resume. And it's been 16 wonderful years.
It's amazing. Okay, so if we're thinking of sort of mission and day-to-day operations, one of the things you already alluded to, Marv, is the idea of continuity of care. And so maybe quickly, I think everybody knows what that concept is, but maybe quickly say why is that so instrumental to good healthcare? And what specifically have you guys noticed happens when there's not continuity of care, and how bringing that to people's lives has been such a game changer?
Let me first of all say what's unique about Grace, and it will lead to that. When I walk into my doctor's office, I walk in and I walk out. When you walk in here at Grace, you walk in and you're embraced by so many different people. It's really exciting. It's integrated healthcare. We've talked often how medicine's become so siloed and so compartmentalized. We here at Grace try to fight that because it's not what's best for our patients. It's hard for our patients to get to the doctor. And when they're here, we have to maximize it. So when our patients come in, it's very common for them to be welcome. This is our welcome room, not our waiting room. Spiritual care is in here helping them. We have someone guide them up to the exam room. Many times mental health and social work are in on the visits. They check in on their referrals. Nutrition comes to visit them. So that's kind of what happens. At other visits, they can come for specialty care. So it's an embrace. And so our patients, when they come here, usually their first visit, they don't have their medical record with them, or it's in their back pocket, or it's in the files scattered. And they say, here's my problems. And so what we try to do is take whatever they bring us and then try to come up with a game plan that might help them. They are not used to continuity of healthcare. We have to work very hard to let them know that we're going to see you again. And we have to spread out their visits to where they can take off from work and like I said, to maximize those. And so they're not used to that. And it sounds like when you say 13 times a year, that sounds a lot, but they come here for everything. Mm-hmm. And they're used to us and they're comfortable with it.
Speak to a second, and again, I don't want to spend a ton of time, but how is Grace funded?
So we're completely privately funded. The reason why we have so many volunteers, we have more than 300 physician volunteers. Many of them are retired, and that's...
Pause for 1 second.
Yeah.
Say that again.
Okay, I know, it's amazing.
Yep.
It's really extraordinary. We have over 300 physician volunteers, and they provide 35 specialty clinics on site. They'll also see patients in their office. They'll help however they need to.
But I go to my doctor and I need to see a cardiologist. I go to in a lot of these specialty situations, they are here.
Oh, yeah.
You're coming to the same spot.
So our primary care doctors may have a visit and they'll say, oh, I need you checked out by a cardiologist. Come next week. And then in 2 weeks, let's go ahead and get your ophthalmology exam. I mean, ENT. I mean, we all want to be patients here. Like, it's unbelievable.
Dental and the
mental health.
Mental health,
and,
right.
Just.
Every dentist in the dental department are volunteers. There's over 40 specialists that come once a month.
So I interrupted you on the funding.
Right. So the reason why I mentioned the volunteers is because we're very blessed in Florida. We have the strongest Good Samaritan law in the country. And that's why we have so many volunteers. So anybody with a clinical license, if they're volunteering here, they get that malpractice coverage through the state. And it is no cost to Grace. So that's why we have so many. And that's been law since 1992. There's never been a claim brought against a free clinic in the state of Florida. There are about 110 of us. Grace is probably the biggest or one of the biggest. So it's a great state law and it encourages volunteerism. And Florida's blessed to have a lot of retired clinicians. But it is very clear under that law that there can be no remuneration for services rendered, meaning no billing. We cannot bill. We cannot get any third-party reimbursement. So all of our funding is philanthropy, privately raised, and it's a budget of about $4.5 million.
How has it morphed or adapted through the years as you've discovered different needs? And
it's a great question. I could probably jump in there.
Yeah.
A couple of days before we opened, we said we cannot see these 5 things. We cannot handle these 5. They come in, and we basically were saying we can only do primary care. Those 5 things had to do with needs outside of Grace. Every one of those happened the first week. And so what we began to see as we addressed the primary care needs of our patients was their barriers to health beyond primary care. So specialty care, dental care, access to medicines, access to food, being able to do labs or imaging studies. And so surgeries.
Yeah.
And so procedures. So basically Grace grew addressing those barriers one patient at a time.
Responding to what you discovered, yeah.
We would see several patients in the morning and shut down in the afternoon just to figure out how we were going to help that one patient get a mammogram. How is this one patient we're going to follow up on that abnormal EKG? How are we going to get them to have this procedure done that it needs to be done at the hospital? And so that's how Grace grew. It's easy to walk around. Our building now is 19,000 square feet. It's easy to walk around and say, oh, poof, this must have just happened. It did not. It was one patient at a time addressing need and growing and really inviting the community. That's how Grace has grown. It's just addressing barriers and then inviting the community to help.
All right, I want to take a quick little tangent. I want to ask you, because just more from a organizational, day-to-day operational leadership, that requires a lot of nimbleness.
Yep.
So
that's one of her favorite words.
So how do you make sure that is core to the culture here?
I think everybody here is just such a huge patient advocate and follower of Christ. And so we pray before we try to figure out how we're going to solve this. We're open. We talk with each other. And I think the team, we have a wonderful team. We have 43 staff, and they really embrace whatever is needed if it's going to serve the patient. So, a few times we've had to say no to different opportunities because it wasn't on mission or it didn't really help the patient. For instance, there's a lot of clinical trials or research opportunities that people will say, oh, we can pay your patients, but we want to, do these testing on them, and we're only going to talk to them if it can truly benefit our patients, things like that. Yeah, I think it's just because we have a staff that wants to serve our patients.
Yeah, both of you guys, adventure and advocacy.
Mm-hmm.
Any insights into what it is about our conventional healthcare system that robs us of adventure and makes it harder to focus on advocacy?
We have a lot of medical schools, either pre-med or they're trying to get into medical school or they're doing a rotation here. And one of them in pediatrics was doing her residency, and she kept, every time she was at Grace, she would say, I can't believe it. I can't believe it. And I didn't know what she meant. And I finally pulled her aside and I said, well, you keep saying that when you come here. What is it? And she said, you're trying to do everything to support the patient while they're here because that's in their best interest. She said, all of the other places I go, it's, come back another time, for billing. I mean, we're fee for service. That's our reimbursement method. And so I think that can rob joy. And I see it with our volunteer providers that they don't have to hassle with insurance companies. They don't have to get a prior authorization. They can spend an hour with the patient if that's what's needed. And they love giving back. It is so humbling to have all of our physician volunteers here wanting to serve.
Just real quick, you mentioned continuity care. What are the downstream effects if someone isn't receiving continuity care? I mean, you mentioned ER visits, and everyone knows unnecessary, too many ER visits is not a good thing anyway, right? Health, financial, whatever. What are other downstream effects when someone doesn't have continuity care, including some that may have nothing to do with health the way we typically think of it?
Delay of care, delay in diagnosis is a big one.
And everything's harder the more advanced it is to treat it. Yeah. Okay. That's a good one.
And significant delay of care. I mean, they can go for a long time because they just didn't have the money to do that. The other is addressing all the other things that aren't typically covered in a medical visit, but have everything to do with health. It's the social determinants of health.
So the social determinants of health are, all of the things that impact health. And what we know is access and quality of care is just 20% of overall health. 30% is personal choices and lifestyle choices, smoking, for instance, or drug use. 40% is the non-medical factors that impact health. Do you have transportation? Do you live in a safe area? Do you have healthy food? Do you have education and resources to understand the different choices that are being made and how those impact health? So, that's a big chunk. But we have a whole team of 3 social workers who, and then they work with students to connect patients to resources if we don't have them. We have a food pantry here. The social workers or the physicians or the MAs can come down and get healthy food and give it to them if that's the need. They connect patients to job or teaching opportunities or education services that they may need. So it's incredible. And so a social service need is treated the exact same way as a medical need in the EMR. And we follow up. Did they get it? How are they doing?
But that's what happens when you have continuity of care. You're able to look at all those other factors that will affect someone's health. And what we saw early on, if they don't have food or transportation, or they have a hole in the roof of their house, they could care less about taking their medicine. And so by having continuity of care, by seeing them over and over, we're able to see how those social determinants of health can affect their overall health. The other significant thing that we see here is, and through continuity we're able to address, is just childhood trauma, events that have happened in their childhood, in their past, that affect their health today. And there's great examples of that here. Patients will come in with headache, stomach ache, can't sleep, can't focus, not doing well at school, withdrawn, and we screen them for childhood trauma. And
which they all have.
Right.
And
because this is a defined entity, adverse childhood events. Y'all have been so intentional about that. That's a defined list. We don't have to go through the list, but it's things that they've experienced or they've witnessed, and y'all screen for that.
Yep.
We screen and then address it. And then it's amazing, Michael, the patients who would come in with their eyes down, not looking at you, over time, their eyes are lifted and they're smiling, and all those things they complain of are gone. And so that's been eye-opening for us. It's been transformative for our staff to be a part of it, to see how much our patients have changed. It's been cool to see them also embrace that. Our staff has not shied away from tough things, and the patients get better.
All right, going back to the mission, one of the things that you guys have talked about is that your mission is reflecting the heart of Christ through healthcare. Both of you share, if someone said, okay, I hear that, how is that just different than good people giving good care? How is it? No, it's more than that. How does reflecting the heart of Christ affect the way you guys operate and give me specific examples. How do you interact differently because of that?
Yeah, so I think for me, it's reflected in our cultural expectations. We have a document that we review weekly at staff meetings where we'll do cultural shout outs. Every staff member, it's on their performance review annually. We talk about when we make hiring decisions, and it really embodies 5 key behaviors that we're expected to follow and live out here at work. And that's champions relationships, proactive compassion, radical respect, committed to excellence, and
Servant
leadership. And so I think that's what, for us, that's how we've defined what Christ-centered care looks like. Those 5 values are how we want to live out in the image of Christ, because I think that's how he lived and treated other people. And so I would say that it's really shaped our culture and how we talk to each other, how we are expected to perform in the workplace. And
so it translates into very specific values.
Yes.
Based on the heart of Christ.
Yep.
Our position before Christ is no different than the patient we're serving. And so here it's about locking arms. It's about being eye to eye. It's about knowing that this person is loved as deeply as I am by Christ. And it's extending that mercy that I've been given. It's not necessarily to be the hands and feet of Christ. It's that you get to see Christ in the people that you serve.
You get to see Christ in the people we serve, but also Christ at work. I mean, God, we just celebrated our 15 years of impact. So we're starting our 16th year. And this is God's place. This is not me or Marvin or our founders. I mean, it's just not. And we've seen that again and again. I mean, we've prayed. It's superhuman what's happened here. And the only explanation is God. I mean, I literally, in those early days, one of our founders, Dr. Kirsten Carter, said, "Oh, I really need a Holter monitor." And we prayed for a Holter monitor. Nobody knew how to get one. And we would have medical salesmen who would come in thinking we were in private practice. Well, I would talk to all of them, thinking maybe they'll donate something, and they would run out. And the minute I said low income, uninsured, no reimbursement, they are out the door. And so a guy came in and I ran out to the lobby. We weren't open yet. And I'm talking to him and I tell him who we are, and he's still sitting there. And I'm like, okay. And he's like, yeah, I do medical sales for Orlando Health. And then he said, I'm a follower of Christ. And what are you trying to do? We weren't open. And then he said, my company, we sell Holter monitors. Can I give you one? I mean, that is God. So we get to see God here, and that's incredible.
What advice would you have for everyone else, physicians in exam rooms, as far as ways to connect with humility on level ground?
You're right, because there is a natural kind of hierarchy in medicine.
Even if you're not trying to do that, right?
Yeah, it's kind of built in. And I think what's helped here is addressing those other needs. It lets them know we care for the whole person, not just their complaint. And so I think that's helped break down barriers.
So they don't see themselves, I'm not just an asthmatic, that they see me as a disease to be treated.
That's right.
They see me as a person.
It's really no different in private practice. It might just be a little quicker there because the visits are a little bit shorter, but it's still trying to establish effective rapport quickly and building those relationships. They like that about Grace, but I think just as much they are thrilled that someone's addressing their medical problems that they have carried for so long. And then the respect. We work really hard here with respect for our patients and how they're greeted and how they're cared for from when they walk through the doors to when they leave. And so I think to answer your question, it's just thinking through intentionally, what would it look like and walk around your office, walk around, what would it look like in this office to practice radical respect?
And we empower our staff, to protect and preserve that culture. And so we've had situations where an MA has pulled a volunteer doctor aside and gently said, that's not how we speak to them. I don't think the doctor was doing anything intentional. They're just
behaving the way the system taught you to behave.
exactly,
right? Yeah.
exactly. Yeah. And so to just have that gentle, we don't do things that way here. What can I do? How can I assist you? Things like that. And it's really great. It's
Well, it
really
is, to
fun.
use a theology term, it's countercultural. It's counter to the culture of our healthcare system.
That's right.
In so many ways. Yeah.
One thing we do that's unique is we have a worship service with our patients once a year. It's just staff and volunteers and patients. And at least one day of the year, they don't have to feel a natural hierarchy, that they're showing up and we're worshiping God together.
Side by side. Yeah.
Side by side, in unison, in their language. And it's, I think,
Eating together,
they love that. We love that even more.
Yeah, that's awesome.
So,
what have y'all learned about our community, about Central Florida being at this place doing what you do?
Oh, I love our community. I think we live in the best community in the world. I think especially those early years, we grew so quickly because the volunteers wanted to come and serve. I mean, in some ways, they grew faster than we were prepared for operationally to keep up. They just want to serve. And then as needs became, evident of what needed to happen, and it's something that's hospital-based or, is something at a higher level than somebody can do here, such as a colonoscopy, we didn't have that. And so we would just call practices and explain what it was. And we would ask them just to do that one thing, that mammogram, that colonoscopy, that one thing, and then send them back to us. And we would keep serving them. And that's grown tremendously. So, we have 65 private practices that, some may say once or twice a year. Some may say, 4 times a month. I'll do a very expensive, procedure for free. And whatever they can give, we're grateful for. And they've really responded. The community's been amazing.
So generosity.
Yep.
But it's what y'all have done is you've created a pathway for that generosity to flow out, because otherwise it was probably just a little bit stifled. All right.
That's right. It gave a place for it.
That's
a
right.
meaningful place for the community to jump in and give tangibly, a place that they could see. And that was intentional from the beginning with the founders of Grace, with the board of Grace, to invite the community in. This is the problem here. Almost 20% of our county was uninsured when we started.
Okay. So even going back to the question, what have you learned about our community? You've learned the degree of uninsured.
Yep.
And that's high, right? That's high relative to.
Yeah. And it goes up and down. It's lower now, but because our county's grown, it's still about the same amount of people that are uninsured. To tag on to what Stephanie said, we wouldn't be here without the hospital, both Advent Health and Orlando Health, and how they've jumped in and helped and embraced and what we're doing, and as well as all the volunteers that have come.
What have you learned about our healthcare system that maybe even more than you knew before you started this? And so part of what I thought I've kind of had of late is sort of just the idea that exaggerated versions of something help you understand everything more, even the more subtle forms. So take the example of HIV. We learned so much about the immune system because of the exaggerated immunosuppression COVID. We learned so much about public health, airborne versus droplet. All these things, right? Exaggerated examples of things help you understand subtle truths. So you guys in some ways have jumped into almost the most exaggerated difficulty of our healthcare system. It's the uninsured. What have you learned about our healthcare system that everyone kind of needs to be aware of?
We have a lot of challenges. There's a lot of money.
Yeah, and it's we talk about this often. We feel like we're swimming upstream every day.
Yeah.
It is it can be lonely, it can be hard. The heart you probably weren't ready for this answer, but the heart of the medical community here in our town has greatly touched us. We've seen that firsthand, whether it's helping Grace patients or other patients, we've really got to see that heart has been impressive. I want to hear what you have to say, Stephanie, but the frustration is still there. It's why is our system set up to leave people behind? Why is our system set up that's fragmented? It's not right. It's not, it only hurts our community when that happens.
Any answers to that question? Any insights into why? Because I don't think it is if I have to go back to medical school, I have, again, another one of these theories. I think most people go into medical school with a pretty significant chunk of their motivation being, I want to help people. I know it's cliche, but and then I think if you look at these same people when they're mid 50s, something has sucked that out a little bit. So whatever percentage it was, I would guess is a little bit less when they're in their mid 50s, which is probably some of the volunteer exuberance to kind of reconnect with what it was that got them into medicine in the first place. So long-winded way of saying, what is it? What's some insight into the system, the headwinds?
One thing, I just want to say one thing, just speaking from that. In med school, your positive reinforcement came through your grades and your letters of recommendation and your what your advisors would say about you at the end of your rotation, and in residency, your quality of care. How well are you following evidence-based guidelines and the care you're delivering? And something changes outside of that. It's our system is set up based on reimbursement, and the more patients you see, and that's where the positive reinforcement can come from. And so that's there. That temptation is there. All I was trying to say earlier was the heart of the folks that have helped here. I know that's happens because it's a machine, but we at least have been able to see their heart, and it's good.
Generally, I think healthcare is so complex, and there's a lot of reasons why we're in the situation where we are today. There's a lot of money, that's just so much money in healthcare, and some of that money prevents reforms that probably should happen. So it's very, very complicated. What I get frustrated with when I think back since we opened is that these are real lives, and the kind of the changing policies, and I'm not getting into one way or the other, but I'm just saying these are real people that things will come in, and government leaders will, the rhetoric or things like that. These are real people that it's just, it's a little bit exhausting. I wish that some of I go to Tallahassee and I advocate for our patients, which I love. It is a privilege, but most lawmakers, don't even know that there are people that fall through the cracks. There's a misunderstanding of it. So I just I wish that there was a better understanding. It's a complex system. There are no easy answers. And sometimes our patients, not sometimes, our patients often pay the price.
Help people, listeners, understand how important policy is to people's lives. That public health and policies, to some degree, are influential and part of what has to be addressed in order for these. How have you seen that? You say you go and advocate.
Yeah.
Why is policy so important? I guess I'm saying.
It's absolutely critical. I'll give you one little example. I told you about that sovereign immunity, which is so important. Okay. It is so important for all of our clinicians.
Protecting the volunteer clinicians.
Correct.
That's right. Everybody, actually. Yeah.
Yeah. So whether they're working or they're retired, they really need that protection. Well, if they became insured, it's clear that if there's a revenue stream, they would lose that. It would break that. I understand that. But, Medicaid, emergency Medicaid is a very, it's not well known at all in the state of Florida, but it's a safety net so that if a patient is hospitalized and can get, emergency Medicaid for 1 month or share of costs for 1 month, things like that, there's reimbursement for it. So that's great. I mean, the hospital should get reimbursed if there's a system for that. But once that we don't even know. Sometimes we didn't know if they went to the emergency room, and then they'd come to us for follow-up care. And we would say, wait a minute, you got put on Medicaid share of cost. You now have coverage for the next month. Well, that doesn't work for us because then that breaks that immunity. So we changed the law and said we have 30 days to transition them to the next point of care if that insurance sticks. A lot of times they lose it with Medicaid share of cost. But that little thing, that little tiny example is a big difference, to come back and get their last
maintaining
med
continuity
refill.
care. Everything
Yes.
said about continuity care. Yeah.
That med refill or whatever it may be.
It's so important to know in our state, just because you may be low income, especially an adult, it does not mean you get Medicaid. It does not mean you get government care. It does not mean the government jumps in and provides all your medical care. That is a misunderstanding in our state. And, there's, I don't know the latest stats, but it's around probably 170,000 are uninsured in our county. That's over 2 Citrus Bowls filled with people. And so that's a misunderstanding that a lot of people just don't know. Where we stand with other people in our community trying to help that gap or help those people that don't have any insurance.
If you had a magic wand and you could change something in healthcare over the next decade, any ideas what you would love to see happen?
I really worry. I've seen, through the patients, how challenging it is living, with a wage it's not a living wage. And so I don't necessarily have the answers, but that's gotten worse. And, how do we ensure that either they're the right jobs or they're paying the right amount or, whatever is needed. It's, to live with a family of 4 at a household income of $33,000 is not a living wage in our community. And so that raises so many other questions, housing, jobs.
Or even separating healthcare from that issue entirely somehow.
Yeah.
I mean, yeah. Marv, anything you'd love to see?
I'm not a politician and I'm not into public health, but if there's some way we can make primary care less expensive, let's just start there. Let's just start with primary care and make that easier for people to get. I think that if we did that, I think it would snowball and it would evolve into something.
Yeah, well,
good.
and that does, because I mean, again, whole nother podcast, but the idea of, well, what are the incentives or disincentives for medical students to go into primary care, and how are we facilitating high quality primary care, an adequate number of primary? I mean, there's a lot that I would almost expand on your answer and say, how do we just prioritize primary care in this healthcare system that we have more than it is? And that, I know that's very self-serving, but I even once I'm long gone, I think that is part of the solution.
So true.
I agree.
Yep.
Okay. What makes you guys hopeful when you, and you, I think have shared some of these things, so you feel free to say an answer you've already said, but from your seat, all the things you observe with the frustrations that you don't just observe, but you experience, what makes you hopeful?
I think not an easy answer, but a hopeful, wonderful answer to that is the amount of students that are here at Grace, and to see their excitement, to see them, somehow this place taps into the heart of medicine. It gives them fuel, we believe, to help get them through the next several years of training. So we have 10 or 12 undergraduate pre-dental school interns here, and they take charge up there. They are hygienists. We have graduate level mental health counselors and social workers here. To see their excitement, and from day one, how they embrace our patients and their tough problems is great. And then there's probably 18 students that are gap year students in between college and med school or college and PA school. This year we had 8 former gap years come back to do a 4-week underserved rotation in their 4th year of medical school. And so that gives us hope. They're excited here. They care for the patients deeply, to see how moved they are and how they take initiative on their own. I'm real excited about this next generation and what's how they help us immensely. They're helping us scribe and in the med room and helping with referrals and in the dental department and counseling. They help us immensely. But to see what it does to them and how it changes them has been just terrific for us.
What about you, Steph?
I totally agree with the students. They're amazing. They are so bright and they're just wonderful. And they stay in touch and they're going through their residencies and things like that. And we'll get them back. These are going to be the next generation of employees at Grace Medical Home.
Right.
Beyond that, I would say that the volunteers. I mentioned the 300 physician volunteers. We have over 1,000 volunteers who come. A lot of them are students, like Marv was saying, or they'll serve as spiritual care ambassadors or navigators or front desk. I mean, just a ton of volunteers. And them and community partners, our community has been so generous as we've grown and helping us. And I think so I'm just really encouraged that the people are just, they say yes. Not that we can get everything. And we are very good stewards. We're, the doctors, by the time we call to ask for something that we can't do here, they've been seen by, a specialist. We know they need that hysterectomy or whatever it may be. And now they say yes, because we have the reputation that, hey, that's the prevention, that's taking care of that need and keeping that person healthier before something ruptured and it was 10 times worse. And so I'm just in awe of the community and how it's responded. And so if anybody wants to get involved, we'll find a place for you. Go to our website. But it's a lot of fun and it brings me to my knees every day I'm here.
No doubt. I love to tell you a great story about one of our volunteers, a longtime volunteer. She started here and one of her first patients had gastric cancer, a young lady in her late 20s. And this volunteer doctor is a strong advocate. She encourages all of us. And that patient who had gastric cancer, her surgery was arranged, the treatment, everything through Orlando Health. It was all set up and ready to go. And we are grateful for that. But the patient came in the week before and said, I can't have this surgery. I'm sorry. And it was going to be life-saving. And at the time, and the doctor said, what's the matter? She goes, I have no one to take care of my kid. So that doctor got her whole street involved in Winter Park. They went to her house. They did their child care, provided food. They realized they didn't have a bed to sleep on. They didn't have plates or utensils or anything. They furnished their whole apartment for them. And to see what happened with that doctor, that volunteer, like you mentioned, to see her get so fired up and involve her community to help with this patient it's just amazing.
There's been a recurring theme that a picture that keeps coming to mind of this. I don't know if it's like a oil deep in the ground or it's a resource that's untapped that's there, that wants to flow, but it needs something to provide access or and Grace has done that. Whether that's the volunteer physicians, the volunteer of the community, the generosity of the community. I mean, it's not that you've had to stir that up. You've had to create pathways for it to flow.
Yeah, and I mean, we've all had medical problems that come up, and I think it does relate to people that even if they don't understand poverty, they can understand, hey, I've been sick before, or I've had to see a specialist, or I've gone without, or something's happened to me.
Yeah, sooner or later, healthcare is a universal thing.
I'll also say, in 16 years, the Grace community, and I think that includes anybody. I think it's staff, it's donors, it's volunteers, it's trustees, I mean, we have walked alongside each other. I mean, it brings me to tears and what we've celebrated or mourned or, whatever life stage that is. And it's really special. And it's a really special community that's been built.
So before we put Marv on the hot seat, you and I will get to watch while he has to answer some questions. How you started to allude to it. How can people get involved?
Oh, there's
or
so many
learn
ways.
more. Yeah.
Yeah, so many ways. I mean, probably the biggest thing, if you want to learn more, come for a tour. You can call me, you can call, go through our website, you can reach out and we can take a tour and talk about what things might interest you. But it can be, one-time projects such as a supply drive or a medication drive. It can be ongoing volunteer opportunities. It can be a corporate, do something with a company. There's just all church, get involved with a church group or something. So there's all sorts of ways to get involved. And so, yeah, we love to talk about that.
Yeah. And prayer, and knowing about grace. There's many people that have never been down here, but they know about grace and they refer others here and connect us with resources and then, yeah. So those are the big ways. And obviously giving, if someone feels led to do that, it goes right to help our patients. There's no fluff here. It goes right to care for those that aren't used to receiving it.
All right. We'll link to the website. Marv, you ready?
I guess, but I have a microphone in front of me too.
Yeah. If you were not a pediatrician, you would have been
I would love to be exploring in the mountains. But what I realized real quick is that I'm exploring here. So that's kind of
you combine
me. Yeah, I would love to be
an outdoorsman.
Outdoorsman, building trails, drawing maps.
Just born like Jimmy Buffett, you're born 200 years too late, maybe. Yeah. Greatest college football coach in the history of the state of Florida.
I know who you're going to say.
It's rapid.
It's got to be Bobby Bowden.
Okay. This is rapid. These are the rules. You have to answer quickly.
The greatest.
Predicted score in this next year's Edgewater Boone football game.
77-0.
Boo.
Edgewater.
Okay. True, false. When you were in high school, you could jump over a car.
True.
All right.
And in college.
Okay. You just had to throw that in there, right?
Yeah.
The Spanish word for soap.
That is very funny. Jabón.
You know it. And the
Yes.
Spanish word for soup is what?
Sopa.
Marv,
I learned that from Dr. Middleton.
Yes. I remember that day vividly.
Yes.
I will never forget that
and you
day.
laughing.
Yeah. What do you know about Adair Fletcher Middleton that I do not?
You know probably everything about Adair Fletcher Middleton, but I do know the delight that she had when she met you.
Oh, okay.
And then I do know also all the guys that would drive down our street and would drive slow or in front of her house, wondering if she was home.
That's great.
So
I'm glad they kept driving. All right.
Yeah.
When you think of Grace Medical Home, the thing you are most proud of?
that we're still open, but know that our staff in the community gets it. That just brings so much joy. I walked in recently and the staff and volunteers are singing happy birthday to a patient that is really, really sick and has no family here. And they did that impromptu. They figured out it was his birthday and had gifts and sang. So the fact that our patients, our staff and volunteers embrace our patients, in the same way we want to be embraced, it brings so much joy that you cannot. People ask, it's back to metrics. People ask often, well, how come you don't have another grace or another grace or another grace? So many staff and volunteers have come through here and pre-med students and pre-dental students. There are other graces. It just looks a lot different. So that brings so much joy.
The title and theme of this whole podcast is Caring Well.
Mm-hmm.
I'm pretty sure I don't know an organization or individuals who embody that more than you guys.
Mm.
So thanks for caring well for our community, and thanks for coming on the podcast.
Thanks for letting us on.
It's a lot of fun.
Yeah,
A lot of
it's
fun.
been great.